If you've been diagnosed with cancer, the anxiety around having a follow-up mammogram, CT scan, or MRI can be hellacious. And for those of you living with metastatic disease, it can be super brutal hellacious. As a matter of fact, getting scans after a cancer diagnosis sucks so much, it has earned its own nickname, Scanxiety. So today in the recovery room, to help you with this, I'm going to give you a Scanxiety playbook. I'm cancer physical therapy specialist, Dr. Leslie Waltke. Welcome to the recovery room. If you are new here, the Recovery Room is an educational channel for people during and after cancer treatment. We have a ton of short, positive, easy to understand, medically accurate videos on cancer, cancer treatment, cancer exercise, and recovery. Our followers and subscribers are called roommates, and generally we're really cool people. So hit the follow and subscribe buttons to join us. Back to Scanxiety. There's really no way around the fact that cancer-related scans are just stressful and anxiety-producing. But let's give you a playbook to hopefully, well, make it suck less. But before we even get to your Scanxiety playbook, two things to note. Number one, when you feel anxious, it is smart to assess your anxiety. Figure out as best you can what exactly is it that's making you anxious. Is it the test or scan itself making you anxious? Is it the post-traumatic stress of walking back into the cancer center or hospital where you were treated or got bad news? Or is it the potential results that is freaking you out? Figuring out which one or ones of these is ratcheting up your anxiety will help you and your team better plan and combat it. And number two, please know and acknowledge it is totally okay to be nervous and feel like you're gonna vomit. Why wouldn't you? This is your life we're talking about. So start by cutting yourself some slack. And yes, it is okay to be mad that you have to do this, because no, it is not fair. Your Recovery Room Scanxiety playbook will have 3 sections: your before scan plan, your distraction plan, and your post-scan plan. Let's go over each of those. All right, section 1, before scan plan, part A. You are rightfully anxious. So heck yeah, it is okay to ask for support, love, and understanding. If you want, put out a post on social media or reach out to your cancer supporters or others that will understand and throw a bunch of love your way. That is always nice. Part B, decrease the stress you can control. Plan ahead for scan day. Think through what time will you need to leave home or work to give you plenty of time to get where you need to go. Visualize, how are you going to get there? Where are you going to park? What door will you go in, and where do you need to report? Thinking through these things should make your arrival much less hectic and stressful. Section 2, the distraction plan. Sitting in waiting rooms can be the worst. So let's distract your brain. If you'd like, take someone with you or have someone ready to have a fun text conversation with. Cue up some favorite music or short YouTube videos. And what a great time to binge watch The Recovery Room. And here's a great one. Instead of sitting in the waiting room, ask if you can walk the halls or outside. They can text you or call you when they're ready for you. Just have something ready to do so your brain has less opportunity to veer off into worst case scenario land. And finally, section 3, the post-scan plan. Before you head to your scan, have your post-scan plan ready. If it matters to you, you have the right to ask what radiologist will be reading your scan and writing up the report. You have the right to ask about when will it be viewed and when will your doctor be notified of the results. Ask too, who will notify you about the results? When will you be notified and how will you be notified? This should help you cope with the next hours or days waiting for the results. So there you have it, your 3-section Scanxiety playbook. Also, please talk with your doctor, nurse, or navigator to help you with additional ways to best cope with Scanxiety. If this video was helpful, please pass it along to others, and in the comments section, let us know if you have Scanxiety, and if so, how do you cope? I'm Cancer Physical Therapy Specialist Dr. Leslie Waltke, signing out from the recovery room. Let's talk again soon.